Today we will be discussing how to communicate and counsel those who are experiencing symptoms of depression, specifically university students. We would first like to start by giving an overview of what depression is, the impact it has on students, and the treatments available. The presentation will then move on to how we as future nurses can effectively communicate with those suffering from depression.
In society today, depression is one of the most commonly found forms of mental illness. An accurate definition of depression can be described as a mood or emotional state that is marked by feelings of low self-worth or guilt and a reduced ability to enjoy life. A person who is depressed usually experiences several negative mood symptoms.
Major depression presents itself as a daily impairment that lasts for more than 2 weeks and affects the activities of daily living for those individuals. The Britannica Encyclopedia defines depression extremely well, stating feelings of sadness, hopelessness, or pessimism, lowered self-esteem and heightened self-depreciation, a decrease or loss of ability to take pleasure in ordinary activities, reduced energy and vitality, slowness of thought or action, loss of appetite, and disturbed sleep or insomnia. The persistent feelings of sadness, anxiety, and empty mood not only cause severe disruptions in appetite and sleep schedules, but they also negatively impair a person's performance, motivation, and their relationships. In order to be diagnosed with major depression, a minimum of 5 of the major symptoms mentioned must be noted daily for a 2-week period or more. Depression in university or college students is evident because the huge stressors that come along with the difficult programs of college and the adjustments that come with beginning a new life. Many students struggle with leaving home, their routine, and structured environments. During exam periods and stressful times throughout a given semester, students are more likely to be depressed than they would be during slow points in school or on vacation.
It is believed and accepted that depression is caused by a number of factors, including genetic predisposition, chemical imbalances of hormones, and external events. It is widely known that many illnesses and diseases occur because of genetic predisposition. Depression is among the mental illnesses that this is true of. It is accepted that those whose family has a history of depression are more likely to one day suffer from depression problems. Pharmacological treatments for depression act on neurotransmitters found within the brain. This is due to the theories that state that a chemical imbalance is what causes depression to occur. Another thought factor of causing depression is stressful or traumatic events such as the loss of a loved one, other medical conditions or diseases, or hardships. There are many forms of treatment and coping mechanisms for major depression. In our society, the most common forms of treatment are psychotherapy and pharmacological antidepressant therapy. These two treatments are the most commonly found, but not necessarily the most effective or the only ways to cope or treat depression. Other mechanisms of coping with depression effectively are to engage in lots of exercise, get enough sleep, and to make time for social activities. The form of psychotherapy that has been proven to be effective for depressed people is cognitive behavioral therapy, CBT. The literature found heavily leans towards using exercise as a coping mechanism for major depression.
Depression, the most common form of psychological distress among university students, is frequently serious enough to need to seek professional help, yet only a minority of these students seek formal help. These students seeking help were more likely to be graduates, older population, and living away from family. Some factors that influence whether or not a student will seek professional help are the severity of the problem, the availability of alternate resources, the individual's readiness for help.
Individuals dealing with depression tend to view themselves and their situations as hopeless. Communication is pivotal in helping the client regain self-worth. The key to recovery is that such individuals must come to see themselves as capable of overcoming depression, or at least learn to cope with their fears and disappointments by developing effective strategies. This will provide a more optimistic outlook towards their future. Of course, this is easier said than done. As nurses, the first thing we can do to help facilitate change is provide a supportive and safe environment. Allowing the client to talk about their feelings without judgment or stigma will help build a trusting relationship between the helper and client. When working with a client who is depressed, it is important to reinforce the fact that they are not alone and that many others have recovered successfully with the help of an experienced professional. Avoid saying things such as "cheer up" or there's always someone worse off than you. Although these might seem harmless, telling someone to cheer up is not going to make them feel any better or change the fact that they are depressed. Nobody chooses to be depressed or gains anything from the symptoms. If it was as easy as just realizing they had to cheer up, then I'm sure they would. It is important to honor the client's rights to feel their emotions, whatever they may be. Often, people suffering from depression view themselves as weak or helpless. It is important to reinforce the fact that being depressed does not make them weak. Recognize that their ability to talk about their feelings makes them strong. As previously stated, the most integral facet of recovery is the client learning how to help themselves. Cognitive therapy is one method of teaching self-help. It seeks to help the patient overcome difficulties by identifying and changing dysfunctional thinking, behavior, and emotional responses. This involves helping patients develop skills for modifying beliefs, identifying distorted thinking, relating to others in different ways, and changing behaviors. Most of all, as the helper, it is important to offer support and affirmation through active listening and empathetic cues that promote self-healing. Sometimes just asking the question, "What can I do to help you?" can be powerful as it puts the focus on them to identify their needs and wants. Remember, when helping a depressed client, listening and responding in a non-judgmental manner is vital to developing rapport and recovery.